Hi everyone, my name is Sharon Sanchez and I am in the Pediatric Acute Care Nurse Practitioner Program. I have been a nurse for almost 5 years. I'm just a couple months short of that. Um, so nursing is kind of a second career thing for me, sort of. I started out at Tulane University and was planning to go into physical therapy, and while I was working my internship, got really bored with it, and I saw some nurses start coding a patient up in one of the ICUs and thought like, wow, that looks like fun. I'm going to do that. And so I ended up going back to El Paso, where I'm originally from, and going to community college to get my nursing degree. So I worked at an emergency and trauma center for a few years in El Paso, and then I started traveling. Um, so I've lived and worked in a lot of places: Boston, Baltimore, Houston, um, Breckenridge, Los Angeles, Las Vegas, Pahrump, and also spent a couple times in Ghana in West Africa with a doctor I used to work with in El Paso, where we would travel to small villages and set up day clinics. So kind of a really diverse background and kind of went everywhere. Um, I've actually mostly done adult emergency and trauma care, and I'm transitioning into pediatrics right now. Currently, I'm in Houston and I'm working in a pediatric ICU. I just started a couple of weeks ago, and it's really a nursing culture shock for me because I'm used to the emergency pace and setting, and it kind of just being really um, fast and moving a million miles a minute to the ICU setting that's really structured and intricate. So it's very interesting. It's a great learning experience. Um, I'm making the transition because I'm interested in working with a specific population of patient, uh, particularly children who suffer from PTSD or developmental trauma disorder. And I would like to study the long-term physiologic effects through the lifespan that these children face from a repeated exposure to violence or trauma in the home. Um, and there's a few doctors that are uh, kind of heading the research on developmental trauma disorder, so I would really like to try and get in on some of their programs and research and start incorporating that in an acute care setting through either identification or um, changes in the way that we approach or treat these children who suffer from these diagnoses. Um, so I'm kind of making that transition. Um, it's really interesting. Like my background, I also have in flight nursing, so it's a really different setting for me because I'm used to kind of really um, being in charge of my setting a little more than I get in the pediatric or in the critical care and ICU setting. In my helicopter, it's me and my partner, and we call all the shots. Where with the population that I want to work with, and with children, you're incorporating a lot of other people and factors, so parents and the care team. So it's just a really interesting transition. I'm really enjoying it though, and I'm looking forward to learning more through this program, and also in advanced patho. And so I think it's going to be a great experience. Looking forward to working with everyone and learning a lot more about what we do. Um, so I think in this video also we had to give a random fact. So one random fact is while I was in college to help pay for it, I sang. So I was on a voice scholarship, and so I sang with a few different choirs. Um, and it's actually something I've been able to use in nursing. So when a kid or even adults are really nervous about some procedure or an IV or something, I've actually sang to them before to help calm them down. It seems very effective. But yeah, so that's me in a nutshell. You all have a great day. Thanks for watching my video. Bye.